It's a documentary revealing widespread extortion of monies from patients at the Tamale Teaching Hospital. Robbing the Sick is the product of a year-long undercover investigation by JoyNews following concerns by patients who visit the facility said to be Ghana's third biggest teaching hospital. Tonight, JoyNews premieres the story. In the following excerpt, a midwife detains a fresh mother after delivery because she could not pay 32 cedis demanded by the healthcare worker.
While hanging out on the corridors of the OBS and Ghani department, I met this lady. I've decided to call her Zina. Her sister was detained at the maternity ward. The midwife who delivered her of her baby is demanding money for assisting her during the delivery. This midwife is popularly called Auntie B. She had closed for her nightly duties, but waiting on Zina to pay 30 cedis delivery fee. This is the second time I'm accompanying such distressed patients to pay on their behalf.
My brother and sister, not say we say I'm say also to ask okay.
Such monies are not sanctioned by the authorities of the Tamale Teaching Hospital. Dr. David Akombela is the chief executive of the hospital.
The question of extortions by health personnel from our clients, I've been hearing such complaints on radio and but nobody has concretely brought a report to me on any concrete person taking money from a particular client. But we have taken steps. We've actually written out to notify all staff that it's illegal for anybody to take monies from anybody through any unapproved channel without receipts. So our staffs are aware that when they are caught in that act, they will be reprimanded heavily.
So those are excerpts of that documentary, Robbing the Sick. It will air later tonight. Producer Kwete Nate joins me on the line with more. Kwete, briefly tell us what necessitated this particular investigation.
Benis, the reason why we embarked on this investigation had to do with, several complaints we were getting from residents, complaining about extortion, charging of unapproved fees. So it became necessary for us to go on the ground and verify whether these claims are true. And when we went on the ground, we found out that, yes, some nurses, some doctors, were taking money which they were not supposed to be taken from these patients. And what we found was that when these monies are taken, when you demand receipts, they are not given. And there were some monies which were being taken that were surprising. For instance, like if you're a Muslim father and you want to observe this practice of saying prayers into the ears of your newborn baby, you are charged some money. The nurses demand that you pay a certain amount. Once your wife delivers, you are being made to pay ward fees. When you demand receipts, you are not given. And these many more, findings were what we unraveled in this documentary.
Could you tell us how long did you have to conduct this and what were some of the challenges you went through?
So in January this year, when we had a complaint, we set out some key indicators we wanted to look out because we had reports of widespread procurement breaches by staff there, charging of illegal fees, forging of receipts, theft of equipment by staff. So these were the number of issues that were, in front of us. So those are the issues we set out to investigate, and we ticked many of these boxes. The challenges, language barrier was one of the difficulties, for me. So I had to rely on Hashmin to go about it. Verifying all the claims, time was a big constraint because there were so many departments I would have wished to have gone undercover there, but time was also a challenge.
Thank you. Kwetenate is producer of Robin the Sick, sharing with us his experience gathering and conducting these investigations. For security reasons, we can't put his face out here on TV, and that's why we had him on phone. But speaking earlier on the AM show in reaction to the story, Dr. Eli Atikpi, who is Registrar of the Medical and Dental Council, called for further investigations into the allegations.
Generally, or applying general principles, it is unethical for a practitioner who is being paid to deliver a service to collect, money illegally. Until that is established that monies have been collected illegally, I wouldn't be in a position to really talk about this particular subject. But again, it is against medical ethics. It is unethical for any practitioner who is receiving salary or is being paid to deliver a service to collect illegal fee. That is what I can say in general terms. I wouldn't say your assertions are true. I think, first of all, let's look at the number of the people that we register and license to practice. We're talking about the medical and dental professionals. We're talking about the physician assistants. We're talking about the certified registered and death certificates. These are the only groups of individuals that are registered by the Medical and Dental Council. When we talk about the nurses and the midwives, they are also registered and licensed by the Nursing and Midwifery Council. Now, in terms of really providing a lot of advocacy, I think that the Medical and Dental Council had occasionally gone out there to educate the public, and we also really guide our professionals to make sure that they are aware of what they're supposed to do and what they are not supposed to do. So if you are a professional registered by the Medical and Dental Council and you are aware of A, B, C, D, E, and you go contrary to that, then, we really will take you on for really breaching the ethics of the profession.
The Public Relations Officer of the Tamale Teaching Hospital joins me live in the studio. Dr. Kenose Mensah, thank you so much for your time.
Thank you very much.
Are you surprised by this outcome of the investigation?
I'm not. I'm not because, like I said earlier on the AM show, we had heard commentary of this on local radio stations that people were expressing some concerns about some of the payments they were making at the hospital. And so management has already taken steps as early as January through April this year in trying to create an avenue for people to make formal complaints and also for hospital management to be able to assess the situation and deal with it appropriately. Okay,
talking about formal complaints, we heard earlier the Chief Executive Officer of the Tamale Teaching Hospital say that they had heard these allegations. There were no formal complaints. Beyond the complaints, did you investigate these allegations and claims by your clients or patients?
So when we had the commentary on some of these extortion cases, what we did was that we went into partnership with NGOs in the northern region, Khaled being one of them and then League of Youth being another, to create an avenue for clients of the hospital. If they come to the hospital and they feel that at any point in time they are being made to pay for certain things that they don't think it's appropriate, they have a channel with which they can partner. We also went further than that to do massive education on radio and also in town hall meetings in Tamale to educate the populace on the right appropriate payment channels in the hospital. Beyond that, we also increased the surveillance systems in the hospital, and you'll be amazed to hear that as I speak to you right now, we have 2 people facing court for pretending to be staff of the Tamale Teaching Hospital and defrauding unsuspecting clients of their monies. A member of our own staff is also in court for defrauding clients. So management is doing everything it possibly
What
can.
kind of surveillance are you talking about? CCTV cameras?
We
What
have
exactly?
CCTV cameras in there. We have security officers being asked to check for receipts at service points. We've also, as much as possible, this reportage system has created an avenue for people who even want to report anonymously are able to do that. We've created a client customer service centers in the hospital for people to walk in or even make a phone call. And then your whatever challenge you have, you can report it and the management takes it up. So as much as possible, management is doing quite a lot about some of these situations.
From the angle of those who extort these monies, doctors, nurses, and other staff of the hospital, what really have you found out is the reason they do this?
The Tamale Teaching Hospital is a big hospital. We have a staff strength of about 2,168, and I'll be amazed to suspect that not a single one of them would be deviant. So we appreciate that some small minority of staff, no matter what the situation is, will want to take advantage of.
So this
of
is not widespread as reported, because you say small staff.
According to Kwete, my very good friend, he found 5 people to caught on camera. And even if we do an extrapolation and a projection, that is nowhere near 2,168. And so I still maintain that it's quite a smaller. There are a lot of good people at the Tamale Teaching Hospital.
But Khalid, you mentioned Khalid earlier as an NGO you've partnered. Khalid says this is widespread, and they talk about the fact that this even deters people from seeking professional help. Is that bad? People don't want to visit the hospital. They would rather want to take care of themselves at home.
I think what Khalid may probably be intimating is that even reading from your own social media handles when this story was actually put there, this is not a Tamale Teaching Hospital issue. This is a health system issue. And when I was on Joy FM this morning, everybody who called in did not talk about the Tamale Teaching Hospital. They talk about one other hospital or the other. And so as much as possible, I don't know what they are doing in another hospital because I don't speak for them, but we realize that, okay, it could be a problem. Even if one person is denied healthcare by virtue of the fact that somebody wants to extort money from them, it's still a big issue. This human life we are talking about.
Exactly.
So we are still doing what we possibly can to be able to improve the system.
And so if I walk in, or if I find myself in Tamale next week, next 2 weeks, and I walk into the hospital, what do I need to know as a client or a patient with regards to what I must pay and what I mustn't pay, so that I know whether money is being extorted from me or not?
At the Tamale Teaching Hospital, under no circumstance, like I believe, just like every other government institution, there is no payment you make that doesn't come with a receipt. And we have dedicated pay points in the hospital for payments as such. We have outsourced our payment system to the Republic Bank, and you go there and you are able to make payments. And we've educated the populace and clients that come to the hospital on several occasions. At no material moment in time should somebody take money from you and say there's no receipt for this. The person is trying to steal the money from you. And it was through some of these educations that people reported people we actually found out were not even staff of the Tamale Teaching Hospital, but they were just impersonators in the hospital defrauding people of their money.
So finally, back to my question. If I come and someone is, like we heard in the story that played, is detaining me, is holding me because I haven't paid money they are not willing to give me a receipt for, what do I do? I'm a new person in the hospital. How do I survive?
Like I said, we have customer service centers dotted across the hospital.
Okay.
In the Ops and Gynae building, for instance, there is a dedicated customer service center in there. There are phone lines available where you can call. There is a customer service center at the Ops and outpatient department. So we have created the avenue. And me personally, as a public relations officer, every material moment in time I've gone on a local radio, I put my personal line on air so that people can call if they have issues and we take it up. We are dedicated. Management and the acting chief executive officer want to rid the hospital of some of these practices, and we are on course. And I thanked Kwete for this particular expose. It would deter people from going forward and doing it. And I think it would be a national conversation that would actually probably sanitize the health system.
I know I said finally, but just permit me to ask this one, that the faces we saw in this particular documentary, what's happening to them? What's going to happen to them?
Now that we have irrefutable evidence of some wrongdoing, if we get a copy of the video, of course, there are guidelines that as an agency under the Ministry of Health will be taking them through. A disciplinary committee will be set. Their side of the story would be heard, and then there will be an evaluation, and whatever punishment that is ascribed to doing something like that will definitely. Management will not shield staff for putting us in this situation, because there's still a good majority of Tamale Teaching Hospital staff who, in one way or the other, wake up every morning and want to do good. If I want to spare a bit of your time and tell you the situation at Tamale Teaching Hospital. Northern region in general is the most understaffed region in the entire country. The national average, the recent NNDP Human Development Index, national average around 0.5. In the northern region is 0.1. And so you realize that we have very few people in there doing a lot of work. And it will surprise you also to know that even just at the Ops and Gynae department, there are more deliveries at the Tamale Teaching Hospital than any teaching hospital or any hospital in the entire country. Over 800 births with fewer staff. So there's still a good number of dedicated people.
A day?
A month.
A month.
There's still a good number of dedicated staff of the hospital who are doing everything they can to save lives. And we will not let just a few minority be able to contaminate, in a way, that particular effort.
Thank you for your time, Dr. Ken Osei-Mensah is Public Relations Officer of the Tamale Teaching Hospital. And he's here because that documentary produced by Kwetenate, Robbing the Sick, airs tonight at 8:30 p.m. Do make a date as he, and I mean Kwetenate, shows us how some patients go through a lot of hell because people want to charge them unapproved fees and not give them receipts in return.